What happens to your body months, years, or even decades after your gallbladder is removed? You may have been told, you don't need your gallbladder anymore. You'll be completely fine without it. And while many people do live perfectly well without a gallbladder, there is a much bigger story that deserves to be understood. Because the gallbladder isn't simply a useless little organ sitting beneath your liver. It has an important role in the way your body stores and releases bile, particularly when you're eating fat. And if you've had your gallbladder removed and you're experiencing bloating, diarrhea, constipation, digestive discomfort, changes in your stools, or unexplained discomfort beneath your right ribs, you may be wondering, could these symptoms be connected to what happened to your gallbladder? Today, we're going to take a closer look at what the gallbladder actually does, what changes after it's removed, why some people experience digestive problems afterward, and which nutritional and lifestyle factors are worth understanding. And stay with me because later in this video, we're going to talk about one nutrient that doesn't get nearly enough attention when it comes to liver and digestive health. But first, there's something extremely important to understand. Your gallbladder does not actually make bile. Your liver does. So what is the gallbladder's job? Think of it as a small storage reservoir. Your liver continuously produces bile while the gallbladder stores and concentrates that bile. Then, when you eat, particularly when your meal contains fat, the gallbladder contracts and releases bile into your small intestine. Why does that matter? Because bile plays an important role in the digestion and absorption of dietary fat. And fat isn't simply about calories. The digestion and absorption of fat are connected with fatty acids, cholesterol, omega-3 fatty acids, and the fat-soluble vitamins A, D, E, and K. Some compounds found in vegetables are also fat-soluble. So your body's ability to properly digest and absorb fat can influence much more than what happens to your meal after you eat it. And here's where things become even more interesting. Bile isn't involved only in fat digestion. It also participates in the body's process of eliminating certain substances through the digestive tract, plays a role in cholesterol metabolism, and interacts with the microorganisms living inside your gut. That brings us to another fascinating part of the story. When there is an excessive amount of bacteria in the small intestine, a condition known as small intestinal bacterial overgrowth, or SIBO, can occur. Digestive symptoms associated with this can include bloating, excessive fermentation, and gas. Bile also contributes to the environment of the digestive tract and interacts with the gut microbiome. And there's another process you may not have heard much about, peristalsis. Peristalsis is the wave-like muscular movement that helps move food and digestive contents through your gastrointestinal tract. Bile is involved in this broader digestive process as well. So when bile delivery changes, bowel habits can sometimes change too. And that brings us to one of the most common reasons people have their gallbladder removed in the first place: gallstones. But what actually causes a gallstone to form? Gallstones can develop when substances within bile become imbalanced and begin to crystallize. One common type of gallstone is predominantly made from cholesterol. The progression can involve changes in the composition of bile, thickening, or sludge, and eventually the development of a stone. But there is another piece of the puzzle that is easy to overlook: gallbladder movement. The gallbladder needs to contract and release bile. If bile remains stagnant for prolonged periods, the conditions may become more favorable for sludge and stone formation. And what helps stimulate the gallbladder to contract? Food, particularly dietary fat, is one important signal. This is why the relationship between dietary fat and gallbladder health is more complicated than simply saying fat is bad. In fact, routinely following an extremely low-fat diet may reduce the stimulus for gallbladder contraction. But diet isn't the only factor. Hormones, metabolic health, pregnancy, certain medications, and insulin resistance can all be relevant when we're talking about gallstone risk. Hormonal factors can influence gallstone risk. For example, pregnancy and estrogen-containing medications are associated with an increased risk of gallstones in certain people. Metabolic health matters too. Insulin resistance and diets high in refined carbohydrates may be associated with metabolic problems that can also affect gallbladder health. This is why gallbladder problems shouldn't necessarily be viewed as an isolated issue. Your digestive system, liver, metabolism, hormones, and diet are all interconnected. And there's another factor worth considering: thyroid function. When thyroid function is low, many physiological processes can slow down, including aspects of gastrointestinal motility. So when you're trying to understand digestive symptoms, it can be useful to look at the bigger picture rather than focusing on only one organ. And now I'm going to tell you something that many people don't realize. Gallbladder problems don't always feel like what you'd expect them to feel like. Digestive discomfort doesn't necessarily announce itself with a giant sign saying, "This is your gallbladder." Some people experience discomfort beneath the right rib cage. Others may notice discomfort that seems to travel toward the right shoulder, upper back, or surrounding areas. That kind of referred discomfort can be incredibly confusing. Someone may assume they're dealing with a muscular or spinal problem when the source could potentially be somewhere else. This is one reason persistent or unexplained pain should never simply be self-diagnosed. A healthcare professional can help determine whether symptoms are related to the gallbladder, bile ducts, liver, pancreas, digestive tract, muscles, or another condition. But now let's get to the question that brought many people to this video. What actually changes after the gallbladder is removed? Here's the key point. Your liver can still produce bile after gallbladder removal. What changes is the storage and concentrated release system. Instead of the gallbladder storing bile and releasing a larger amount when needed, bile flows continuously from the liver into the digestive tract. For many people, the body adapts very well to this, but some people notice changes in digestion or bowel habits. And this is where things get particularly interesting. Not everyone who develops digestive symptoms after gallbladder surgery has the same underlying problem. One person may experience diarrhea. Another may struggle with constipation. Someone else may have difficulty tolerating certain meals. And another person may have symptoms that aren't related to the gallbladder surgery at all. So the symptom alone doesn't tell you the complete story. For example, some people experience persistent loose stools or diarrhea after gallbladder removal. Changes in bile delivery can contribute to this in certain cases. There are medications that healthcare professionals may prescribe to bind bile acids and reduce their effect in the colon. Certain soluble fibers can also interact with bile acids and may help some people regulate stool consistency. Foods containing soluble fiber, including fruits, vegetables, oats, legumes, and psyllium, can be part of an individualized approach. But introduce fiber gradually, particularly if you already experience bloating or digestive sensitivity. And if diarrhea is persistent, severe, or accompanied by other concerning symptoms, don't simply assume it's a consequence of gallbladder surgery. It deserves proper medical evaluation. Now let's turn the situation around. What if the issue isn't too much bile reaching the intestine? What if you're having trouble digesting and absorbing fat? That is a different question. After gallbladder surgery, some people report digestive discomfort, changes in bowel habits, or difficulty tolerating fatty meals. If stools become unusually pale, greasy, oily, difficult to flush, or consistently float, that can indicate that fat digestion or absorption isn't working normally. But here's something extremely important. Don't automatically assume that means you need a bile supplement. Problems with fat digestion can involve bile, the pancreas, the liver, the small intestine, or other parts of the digestive system. The pancreas, for example, produces powerful digestive enzymes that help break down food. And this is why persistent digestive symptoms should be investigated rather than treated purely through trial and error. Because the gallbladder doesn't work alone. It is part of a much larger digestive system. Your liver produces bile. Your gallbladder stores and concentrates it when you have one. Your pancreas produces digestive enzymes. Your small intestine receives these digestive secretions and absorbs nutrients. And your gut microbiome interacts with the digestive environment. Remove the gallbladder, and the rest of this system doesn't simply stop working. Your body adapts. But that adaptation can look different from one person to another. And that brings us to another important subject, fat-soluble vitamins. Vitamins A, D, E, and K are fat-soluble vitamins. That means normal fat digestion and absorption are important for getting these nutrients from your food into your body. If someone has a chronic problem absorbing dietary fat, deficiencies can potentially develop. Vitamin A, for example, plays an important role in vision. Vitamin D has many functions throughout the body. Vitamin E and vitamin K are also essential nutrients. But please don't jump straight from a symptom to a supplement. If you suspect a vitamin deficiency, testing and professional assessment can help determine whether a deficiency actually exists and why. Sometimes the answer isn't simply taking more of a particular vitamin. Sometimes the underlying digestive problem needs to be addressed. And now we're getting closer to one of the most overlooked nutrients in this entire conversation. Choline. You may have heard the word before, but you may not realize how important it is. Choline is an essential nutrient involved in several functions throughout the body, including normal liver function and lipid metabolism. Food sources include egg yolks, seafood, meat, and organ meats, such as liver. For many people, eggs are one of the most accessible dietary sources. But nutritional requirements aren't identical for everyone. Genetics, diet, pregnancy, overall health, and other factors can influence individual nutritional needs. So rather than thinking that everyone needs exactly the same amount, think of choline as one important component of a much larger nutritional picture. And here's why this becomes particularly interesting when we're talking about liver health and gallstones. Choline contributes to normal lipid transport and liver function. Inadequate choline intake can interfere with normal fat metabolism in the liver. That does not mean choline is a magic cure for gallstones. It isn't. But it does demonstrate how nutritional status can influence the way your body's metabolic systems function. A nutrient-dense diet that provides adequate protein, vegetables, healthy fats, and essential micronutrients is a much stronger foundation than searching for one miracle nutrient. And now let's return to something many people wonder about. What if your surgery happened 5, 10, or even 20 years ago? Could your current digestive symptoms still have anything to do with it? The answer is potentially, but don't automatically assume it. Having your gallbladder removed doesn't mean every digestive problem you experience years later was caused by the surgery. But if you continue to experience persistent diarrhea, chronic constipation, abdominal discomfort, recurring pain beneath the right ribs, significant bloating, pale or greasy stools, unexplained weight changes, or persistent nausea, those symptoms deserve attention. There can be multiple possible explanations. The goal should be to identify the cause rather than simply mask the symptom. And if you experience severe or worsening abdominal pain, fever, jaundice, persistent vomiting, gastrointestinal bleeding, or significant weakness, seek medical attention promptly. Now let's talk about something you'll often see recommended online: bile supplements. Should everyone who has had their gallbladder removed take them? Absolutely not. Remember, your liver continues producing bile after gallbladder removal. The gallbladder is removed, but the liver doesn't suddenly stop making bile. Whether a bile-related supplement is appropriate depends on the individual, their symptoms, medical history, medications, diet, and underlying condition. If you're experiencing persistent problems with digestion or fat absorption, speak with a qualified healthcare professional before starting supplements. And be especially careful if you're already taking medications. More supplements do not automatically mean better digestion. You've probably also heard about another compound called TUDCA. TUDCA is a bile acid derivative that has been studied for several biological effects and is often discussed online in connection with liver health, bile metabolism, and cellular stress. But online claims can move much faster than the scientific evidence. So TUDCA shouldn't be treated as a guaranteed solution for gallstones, bile problems, digestive symptoms, or complications after surgery. If you're considering it, discuss it with a healthcare professional who understands your medical history. The same principle applies to digestive enzymes and other supplements. And there's another piece of the digestive puzzle that we shouldn't ignore: the pancreas. The pancreas produces enzymes that help digest fats, proteins, and carbohydrates. One of these enzymes is lipase, which plays an important role in fat digestion. If someone has pancreatic insufficiency, they can experience symptoms such as greasy stools, bloating, weight loss, and nutrient deficiencies. That's very different from simply not having a gallbladder. And this is precisely why changes in your stool shouldn't automatically be blamed on gallbladder surgery. There are multiple organs and mechanisms involved in digestion. So if your body is sending you signals, listen to them. Don't simply assume you know the cause. Now let's bring all of this together. Your gallbladder is small, but the digestive system it belongs to is anything but simple. Your liver produces bile. Your gallbladder, when present, stores and concentrates it. Your pancreas provides digestive enzymes. Your small intestine absorbs nutrients. Your gut microbiome interacts with the digestive environment, and your diet supplies the nutrients your body needs to keep all of these systems functioning. When the gallbladder is removed, your body doesn't simply stop digesting food, it adapts. For many people, that adaptation happens without major problems. For others, there can be changes in bowel habits, food tolerance, or digestion. And for some people, persistent symptoms may actually point toward another digestive or metabolic condition. That's why your symptoms matter. And that's why your individual situation matters. So, what can you actually do to support your digestive health after gallbladder removal? First, don't automatically eliminate all dietary fat. Uh, Healthy dietary fats can provide essential fatty acids and are involved in the absorption of fat-soluble vitamins. The appropriate amount will vary from person to person. Second, prioritize fiber-rich foods. Vegetables, fruits, legumes, whole grains, and other sources of fiber can support normal bowel function. If you aren't accustomed to a high-fiber diet, increase it gradually. Third, focus on nutrient density. Eggs, seafood, vegetables, fruits, and other minimally processed foods can provide a wide variety of essential nutrients, including choline. And fourth, pay attention to your symptoms. Keep track of which foods seem to trigger problems, when symptoms appear, how your bowel habits have changed, and whether particular meals consistently make you feel worse. That information can be extremely useful when you speak with a healthcare professional. But there's one final issue we need to discuss: the physical discomfort itself. Some people experience abdominal discomfort after gallbladder surgery. In certain cases, scar tissue or changes in surrounding tissues may contribute to discomfort. There are also physical techniques, including acupressure, that some people use for temporary relief. But be cautious. Never apply significant pressure over an area that is acutely painful, swollen, infected, recently operated on, or otherwise concerning. And no physical technique should replace medical evaluation when symptoms could indicate a complication or another underlying condition. So here's the most important message I want you to take away from this video. Is your body broken because you don't have a gallbladder? No, but your digestive system may function differently after gallbladder removal. And understanding that difference can help you make better decisions about your health. Your liver still produces bile. Your digestive system continues to function. But the way bile is stored and released has changed. For many people, the body adapts extremely well. For others, changes in bile delivery, digestion, bowel habits, food tolerance, or another underlying condition may lead to ongoing symptoms. The answer isn't to panic. And it isn't to assume that every symptom has the same cause. Pay attention to your body. Build your diet around nutrient-dense foods. Get adequate fiber and essential nutrients. And if you have persistent diarrhea, constipation, abdominal pain, unusual stools, unexplained weight loss, or other ongoing symptoms, talk with a qualified healthcare professional. Don't rely on internet diagnoses. Don't start multiple supplements at the same time. And don't assume that something marketed as natural is automatically safe or appropriate for you. Now I want to hear from you. If you've had your gallbladder removed, what changed afterward? Did your digestion change? Did certain foods suddenly become difficult to tolerate? Did your bowel habits change? Or did you feel completely normal? Share your experience in the comments because your story could help someone else realize they're not alone. And if you found this video useful, subscribe to Aurlaith Wellness for more wellness content designed to help you understand what's happening inside your body without unnecessary hype. Your gallbladder may be gone, but your health journey isn't. I'll see you in the next Aurlaith Wellness video.